Okay, so now I'm going to be testing cervical flexion. So I'm going to have the patient seated with her feet on the ground and her back stabilized in the chair. This testing position will also stabilize her thoracic spine so it won't do any extra flexion. So the goni positions, I'm going to have the fulcrum lined up with her external auditory meatus, or the ear canal. The proximal arm will be perpendicular to the head, and the distal arm will be lined up with the base of the nares, or the nostrils. So it's lined up. So now what I'm going to do is have one hand on the back of the patient's head and the other on her chin, and I'm going to push forward and while pulling her chin into her chest, and then the infield will be firm, and then I'll take the goni and realign it and have it follow to this at the nostril. And she got 40 degrees, so that's within normal range. All right, so now I'm going to be checking the patient's cervical flexion using the tape measure. So the patient is seated with her feet on the floor and her back supported by the chair. So I've already marked on her body the bottom of her sternal notch and the middle of the tip of her chin. So I'm going to be checking this actively. So I'll have the patient bend her head forward until her chin is almost touching her chest. And then I will take the tape measure and line that up. And I got 1 centimeter, so that is within the normal range. I could also test this passively by putting my hand on the back of her head and on the tip of her chin and bringing her down and then measuring from there. Okay, so now I'm going to be checking her cervical flexion using the inclinometer. So once again, the patient is seated with her feet on the floor and her back supported by the chair. So I'm going to place the inclinometer on top of her head and make sure the dial is zeroed out and aligned with the arrows. And then I'm going to have the patient lean her head forward and tuck her chin in. Okay, and the measurement I got was 45, which is slightly under the average range of motion.
All right, now we're going to test her cervical spine extension. You're going to make sure your patient is seated in a chair, stabilizing her shoulder girdle and her chest by leaning back in the chair. The fulcrum is going to be placed on the external auditory meatus, which is going to be right here by your ear canal. Your proximal arm is going to be perpendicular to the floor, and the distal arm is going to be in line with the base of the nares, which is also the nostrils. All right, so then I'm going to set that to the side. I'm going to have one hand placed underneath her chin and one hand on the posterior aspect of her head. I'm going to use the hand that's underneath the chin to move her head into extension. You're going to go all the way until you start feeling resistance or the thorax starts to extend as well. All right, and you should have a firm infield because of the ligaments and muscles within the cervical spine. I'm just going to line this goniometer up with her ear canal, this perpendicular to the floor, and we're going to move this one into line with the base of her internal nares. And she got 50 degrees, which is within range. All right, so next we're going to be doing cervical extension of the spine but with a tape measure this time. You're going to have your patient sitting in a chair, feet flat on the floor, and you're going to have them stabilize their shoulder girdle and their chest with the back of the chair. You're going to have them look up and back, and as you can see, I've already made a mark on her sternal notch and at the medial tip of her chin. We're going to measure the distance between the two. All right, and we have about 18 centimeters, which is just slightly under range. All right, next we're going to be testing cervical spine extension with an inclinometer. The testing position for the patient will be the same as before. Patient sitting in a chair, feet flat on the ground. Their back is supported by the back of the chair, and their shoulder girdle and chest is supported as well by the chair and by the individual themselves. You're going to place the inclinometer on the center of their head. Make sure the dial is zeroed out so that the zero is in line with the fluid. You're going to stabilize their shoulder, and you're going to tell them to look up and backwards to perform extension. You're going to let the inclinometer follow this movement, and once they've reached full extension, you will read the dial, which is at about 65, and you're stabilizing their shoulder to check for compensation. All right, you're good. 65 is within good range. Okay, now we are going to do the goniometer measurement for cervical lateral flexion. So for this measurement, you're going to use your large goni, and the landmarks are going to be the fulcrum aligned with the spinous process of C7. The proximal arm is going to be in line with the spinous processes down the spine, perpendicular to the floor, and the distal arm is going to be in line with midline of the dorsal midline of the head, using the occipital protuberance as a reference. So first you're going to palpate C7, then you are going to have their head in neutral, stabilizing the opposite shoulder. You're going to make sure to be directly behind them, but for the video I'm not. You're going to move them into full range with a firm infeel from intertransverse ligaments and the contralateral muscles. Make sure that they do not try to compensate by rotating their head. So I'm going to line up my goni with the spinous processes, C7, and the occipital protuberance. Normal range is 22 degrees, and Roenick is above that at 30. Okay, now we're going to do cervical lateral flexion measurement with the tape measure. The standard position and the infill is going to be the same as the goni, and you are going to use a marker or sticker or whatever to mark the landmarks, which are going to be the end of the acromion process and the mastoid process. So I've already done that. I'm going to use the centimeter side of the tape measure and measure from the mastoid process to the acromion process to start, and then move them into the passive motion. So they're already stabilized by the chair, the lumbar spine is, but you still want to make sure that they do not try to compensate with any rotation, flexion, or extension. Okay, now you're going to take your tape measure and place them on the landmarks. The standard measurement is about 11 to 13 centimeters, and Roenick is at 15.5. Okay, now we're going to do cervical lateral flexion with the inclinometer. The sternum position and infill are going to be the same for the goni and the tape measurements. The normal range for the single inclinometer is about 48 degrees. So you're going to place the inclinometer on the top of your patient's head and zero it out by making sure that the bubble with the blue liquid is at 0. Hold it here and stabilize the opposite shoulder. You're going to then move them into that position and making sure that they don't compensate with any flexion, extension, or rotation. And he is at 50, which is the normal range or above.
Now we're going to measure cervical rotation using a goniometer. So the fulcrum of the goniometer is going to be over the center of the head, of the cranial aspect of the head. The proximal arm is parallel to the imaginary line between the two acromion processes, and the distal arm is going to be at the tip of the nose. So you're going to line it up like this. Acromion right here. Line the distal with the nose. Go ahead and turn your head for me. Good. Good. And she got around 65 degrees, and normal is around 50. Okay, so now we're going to measure cervical rotation using a tape measure. First things first is you're going to mark the skin using a pen, a pencil, or a marker on the acromion process and on the tip of the chin. You're going to ask the individual to look straight ahead, and then you're asking them to turn their head all the way without turning their trunk. and then you're going to measure the distance between the two marks. So go ahead and turn. Good. Now I'm going to measure the distance between this mark and this one. And she has 11.5. The normal range of measure is between 11.0 to 13.2 centimeters. Okay, so now we're going to test cervical rotation using a single inclinometer. So what you're going to do is place the individual supine, and they're going to be facing up towards the ceiling. You're going to instruct the individual to roll his or her head into rotation without tilting the head forward or backward into flexion or extension. And the first thing you're going to do is you're going to place the inclinometer on the forehead. You're going to zero it out. And then you're going to hold it firmly while they move their head to the right or left. So go ahead and turn your head. All right, good. And she got around 95 degrees, which is the normal is around 80 degrees.
We're going to be testing our anterior neck flexors. You're going to have your patient lying supine on the table. They're going to have their elbows bent and their hands resting on the table overhead. If they have weak abdominal muscles, you would stabilize the thorax, but since she doesn't have weak abdominal muscles, we don't have to stabilize anything. The testing position for her, she's going to lift her head up off the table and depress her chin towards her sternum. And I'm going to apply a pressure in the posterior direction onto her forehead and have her resist. And she's good. If there was weakness there, they would have hyperextension and forward head posture.
So now we're going to test the anterolateral flexors. These are mainly the sternocleidomastoid muscle and the scalenes. So the patient will be supine with their arms bent, their elbows bent, and their hands resting beside their head. And so what you would do if they had weak abdominal muscles, you would stabilize the thorax, but she's fine. So we're not going to worry about that. So what we're going to do is lift the patient's head and turn it to the side that is not being tested. So we're going to be testing this side. And what I'm going to do is apply pressure in a downward and diagonal position. So I'm going to apply pressure now. Okay, and she's good. So patients will sometimes try to compensate by lifting their shoulders, but she did not. And then sometimes patients with poor posture or forehead posture will have shortened sternocleidomastoids.
Okay, so now we're going to test the posterior lateral neck extensors. The preferred position is your patient prone with their elbows bent and arms resting on the table above their head. You're going to have them turn their head towards you and lift up off the table and apply the pressure in an anterior lateral direction. So like that. And there's no fixation needed for this test. And this is an alternative test for the upper traps, which would be on the contralateral side.
All right, so now we're going to test the upper traps. Your patient's going to be sitting. There's no fixation necessary for this test. So first you're going to have to ask the patient to raise their shoulder and turn their head towards that shoulder. And then pressure is going to be against the shoulder in direction of depression and against the head in the direction of flexion anterolaterally. So you're going to push down like this and push out. And that's the test.